Hey everyone, it's Mary Ann from the New York City Organization of Public Service Retirees. This is video 3 of breaking down Michael Mulgrew visiting Florida, lying to a whole bunch of retirees. So I'm just going to jump right to the videotape.
We read ARP. Many of us read ARP. A couple of months ago, ARP got compared Medicare Advantage to Medicare. And ARP's conclusion, because they feed the system like crazy, Medicare Advantage. That's how they make their money. Not me saying it, ARP saying it. And they said
And
to
the question
you,
is,
and they said, no, you did. My question is, read your own statistics that you publish.
oh, that's a statement.
That's a
Okay.
question.
Right.
I asked you, do you read?
So
And do you read ARP? No, I'm
yes,
sure.
I do read ARP. I get
Because
it delivered to
ARP
my house
came
every
out
week.
and said, outright, after comparing the two, stay with Medicare Advantage.
Okay, so now I know what
Forget Medicare. Stay with Medicare is what he said.
Traditional Medicare.
Traditional So
Medicare.
what I'm going to tell you is that no, I'll let you speak. Okay.
Okay, here it comes. Brace yourself. Brace yourself. Here it comes.
First of all, you can't compare to what we negotiated because it doesn't exist.
It absolutely does exist, Michael. All municipalities and some unions and some private employers like AT&T and Verizon and Exxon, they're doing the same thing, sweetheart. Really. I mean, this, oh my gosh.
There's nothing like it. We've had outside consultants look at it. Nobody has.
Show me the outside consultant reports that said there's nothing like it. I want to see the consultant reports that show what you created is unlike anything that is out there, because all the contracts that we've been reviewing from around the country look very much like what you created. Basically, you are privatizing a federal public health benefit, and all the little things inside it, it's all the same, Mike.
Has designed and put the safeguards into a plan. Remember,
No
Medicare
safeguards.
Advantage started as a program where a group of people can get together and design their own plan. There is no one such thing. Are there ones that are better than others? Yes, but none of them were good enough for us. None of them. Okay? So we designed one, and a very aggressive one, that you can't compare it to yet. See, that's what you keep telling me about, things that are in existence.
But it actually, you can compare it, Mike, because while some of the features of your plan might be unique to you, they're not really unique to people who are very versed in Medicare Advantage. And yet the structure of Medicare Advantage, how it operates, is exactly the same. It also takes out of the control of the federal government our healthcare, and it puts it in the hands of you. So if in 2 years, like the contract allows, you want to pull more value out of the contract, the Medicare Advantage contract, and use it for bargaining because you need to find money somewhere, you will put more co-pays, you will put more prior authorizations onto retirees. The city then is paying $15 a person per month right now for the temporarily suspended prior authorizations that you put in the contract. In 2 years, if you change that, you tell the city, hey, listen, honeymoon's over. Stop paying that $15 a person a month. I need that money for my raise. So now we're paying. All of those prior authorizations come back. The city's no longer paying that liability, and you get a raise. It gives the power to the Municipal Labor Committee the ability to pull money, a value, finance out of our insurance. It takes my Medicare and it gives it to you to control. Why would we do that? Why would anyone in their right mind do that? It takes an act of Congress to pass or change something. That's a very difficult procedure to happen. And yet, Medicare would be safe because they can't even figure out how to get out of where they are today. But if we put Medicare in your hands and privatized it and gave you the ability to manipulate that contract, you would for your benefit.
Existence that is not ours. Ours is different than anyone. We've had it reviewed. There's no such thing like it.
I want to see the review, Mike. I want to see what you think makes it so special. If you come back and tell me, "Oh, it's the review is special. It's our plan is custom made especially for us because you have silver sneakers and you have rides," I will show you many other Medicare Advantage plans that have all those perks. The other thing is you cheapened our plan by thinking that we would want that BS, all those perks, in lieu of what the one thing health insurance was supposed to provide, which you actually said in the beginning of this video. Health insurance is supposed to protect you for any health care related issue, just like your homeowner's insurance or your car insurance is supposed to protect you for liability and damage in your home or your car. I need health insurance to provide me access and cover medical expenses for health-related issues. I don't need a gym pass. I don't need silver sneakers. I don't need a Fitbit. I don't need rides to my doctors. I don't need processed meals after a hospitalization, especially if I'm not a retiree that is currently being hospitalized. These are all perks that are not perks for us. It is only a perk if you use it or if you need it. So basically what you're doing is you're selling me something I don't really need, but you're taking away the one thing that I do.
In fact, what we've heard is a lot of people don't ever want it to go into place because it is the most aggressive and the one you can make the least amount of money on because it's completely centered around the patient and their.
It's not really centered around the patient, Michael, and that's the problem. You put in prior authorizations when we didn't have them before. You put copays in place where we didn't have them before. You didn't put the healthcare centered around the patient. Let's just stop that right there.
Care. That
And
forever.
contracts can be broken.
Contracts can be broken at all times. That's
Correct.
not new. That's what, here's the difference. We do it as a group, not just the UFT. This is an entire group of people. We use
Right, an entire group of people that you basically screwed to pull value out of a health program that's existed for, I don't know, 60 years.
You think that the insurance company wanted to agree to the Medicare Advantage plan we negotiated? Absolutely not.
Yes, of course, they absolutely did. You see, because one of the things that they wanted was they wanted the ability to take the entire program, the whole entire book of business from the city of New York. That's called greed, Mike. That's exactly what they did. And you let them do it. So I think we're showing enough that you're misrepresenting the truth and you're trying to run your campaign and trust off of misrepresentation while blaming people like me as being outside agitators when we can back up everything that we've said. Not only do we say it, but we could also, as we have in our dozens and hundreds of videos, show you that Congress says it, the AMA says it, the Academy of Physicians say it, the OIG says it, Health and Human Services say it. Michael, the only one that's not seeing it is you, brother. So I'm going to make sure that anyone listens to this, whether you're active or retired, no one should be selling off your health benefits. If you're a young person today that is in the union, you need to be aware of what your future is going to look like. You need to understand and respect when a retired unionist tells you, do not sell off your Medicare. You want to sell it off for you, you sell it off for you. We're going to warn you against that. But don't sell off our health benefits. We earned them, we paid for them, we relied on them. And what Michael's telling you isn't true. And unless he can show you all these reports and show you these millions of dollars of fines, I ask Michael Mulgrew to back up everything that he says. If we could show you here, he could show you there. Ask him. That's 3. Have a great day.